before I start, I definitely will have problems with this. I did this once before, and so please bear with me. Maybe as a beginning, can I get a show of hands? How many of you are biologists? How many of you are computational scientists? All right. And how many of you have used ontologies, taxonomies, have built them yourselves? All right, so we have some expertise. This is going to be a very, very basic introduction to ontologies. It will cover a little bit of the landscape, how I will try to give you an overview of how I use them or we use them, and give you hopefully a couple of pointers that will allow you to follow those pointers, explore them a little bit more, and hopefully I can put them in a little bit of a context for you so that you feel comfortable then using them and exploring them. In my opinion, ontologies are the glue that ties things together in biomedical healthcare sciences. And I say the glue because, as you all probably working in the field are aware, we have tons of data sources. They're very disparate data sources. They are in various stages or shapes of organization. They're structured, unstructured. And well, I looked back at the end of my career at AstraZeneca, and I was looking at how much time I actually spent tying data sources together. I was in the informatics department here in the research unit of AstraZeneca in Boston. And normally my job was to analyze data. But when I actually looked at how much time I spent analyzing data, I would have to say it was a very small part. And I spent a large chunk of my time also on organizational stuff and emails and things like that. But forgetting about that, I probably spent way more than 50% of my time gathering data, munching it up, preparing it for other people who then would have the fun part of analyzing it. And that was a scary amount of time for me, for somebody who actually wanted to play with it and wanted to drive value out of it. But unfortunately, somebody needed to do it. And there weren't that many people around who were willing to do that. So I got stuck with gathering data and making them amenable for analysis, I would say, or for presentation for other projects. What I learned over the last years is that ontologies and semantic web technologies are a way of doing this data agglomeration in a much, much more efficient way than I had done it, let's say, 10 years ago. 10 years ago, my paradigm was go in, analyze a data source, analyze a second data source, find communalities, put it into the third data store, into a warehouse. The third data source comes along, I have to rewrite everything, write my schema, rewrite that again, kill all the data, upload all the data from 3 data sources.